Hi, I'm Dr. Tabor with the Spinal Hygiene Movement, and I'm very excited to be able to bring you this information today that I know is going to transform your life and the health of your family. And as you'll see as we go through this, practicing great spinal hygiene is an absolute must for you to be able to live the life you deserve. Over the past couple decades, we've seen a trend that has emerged in not only America, but really worldwide. And it's a devastating trend. It's devastating families. Their entire health is really in jeopardy. And what we're seeing is this concept of spinal degeneration. It's also known as degenerative disc disease, or some people may refer to it as osteoarthritis. But the breakdown of the spine is crippling people's health in today's day and age. In fact, we refer to it as the silent epidemic, because so many times you don't feel spinal degeneration until it's too late, until you have major symptoms that start to flare up, and then you're thrown into our healthcare system, even though you don't want to be there. In fact, if you look at some statistics, the American Journal of Neuroradiology says that 85% of Americans will develop significant spinal degeneration by the age of 50. And I know, as devastating as that is, we used to think that arthritis, that degenerative disc disease, just affected adults as they aged. But now we know that's not true, because more recent studies have shown that almost 37% of people develop spinal degeneration by the age of 20. That's not old age, ladies and gentlemen. This is devastating. We have to do something to counteract these effects of spinal decay. But that's not even the worst. There was a more recent study that was done. Researchers out of Scotland did MRIs on 10-year-olds. They showed that 9% of 10-year-olds are showing signs of spinal degeneration, even though they don't feel anything yet. They don't have any symptoms. Why? Why are we starting to see these numbers in our society? Well, a lot of researchers think it has to do with our sedentary lifestyles. We're starting to become less and less active. We're seeing that kids have to sit longer through school. They're having less recess. They're in front of video games more often. Adults are having more and more desk jobs. We're having to be in front of computers and electronics. We're looking down at our cell phones, and this postural stress is adding up, and it's causing an increased frequency of spinal degeneration. One of the number one causes of disability in today's society is back pain and back problems. It's costing Americans billions of dollars. So the big question is, what, if anything, can be done to lower our risk factor of developing spinal degeneration? And it's my recommendation that we look to a profession that has already been through a very similar problem that we have today with our spine, and that is dentistry. In fact, most people today will live their entire life with their teeth that they were born with, right? Or at least the adult teeth that they've developed. But it didn't used to be like that. In the early 1900s, people by the age of 20 would have regular visits to the dentist to get their teeth pulled. In fact, a lot of people remember, even in the 40s, 50s, or 60s, where dentures were a very common thing for people to wear once you got into adulthood. Dentists back in the early 1900s did little else in their office except pull teeth. In the late 1800s, a dentist and medical doctor by the name of Willoughby D. Miller showed the cause of tooth decay was from bacteria. Food particles would build up in the teeth, and then bacteria would be in the mouth, so bacteria began to eat those food particles, and there was a byproduct of digestion that was an acid. That acid would break down the enamel of your teeth and therefore cause tooth decay. That's important to know, because once we knew the cause of tooth decay, then we could address it and we could develop a dental hygiene regimen to actually prevent it. But that didn't happen quickly. In fact, tooth decay escalated during the early 1900s because of processed foods, sugars that were coming into our diet. So instead of it getting better after we discovered the cause of tooth decay, it started getting worse. A dentist by the name of Dr. Alfred Fones, who is now known as the father of dental hygiene, became fed up with this pulling of teeth in his office, and he decided that we have to do something to prevent this. He began implementing dental hygiene procedures for his patients. Teeth cleanings, educating his patients on how they could take care of their teeth at home. And this movement didn't take off in the beginning. In fact, dentists fought this. A lot of dentists were of the impression that you couldn't prevent tooth decay. They thought that that was just a theory, and the theory wasn't true. Other dentists, they thought, you know what, we have a great thing going here. We're making a lot of money pulling teeth. Why are you going to go mess that up teaching people how to take care of their teeth? And even more than that, other dentists just thought that it was too time-consuming, it was too expensive, people wouldn't do this at home and actually take care of their teeth. Thank goodness Dr. Phones never gave up. He kept pushing forward. He had a vision of people actually taking care of their teeth, having a healthy smile, and keeping their teeth throughout their entire life. Dental hygiene today is a household term. 97% of Americans brush their teeth on a daily basis, and over 50% of Americans say they visit their dentist on a regular basis. This is what we want for spinal hygiene. We want to be able to teach people to take care of their spines, to be able to lower the numbers, the statistics of spinal degeneration, because even though we can get new teeth, we can get dentures, you can't get a new spine. You only have one spine. You have to take care of it. One of the most important factors that allowed dentists to implement spinal hygiene regimens was the fact that they had determined the cause of tooth decay. So we have to actually look into the cause of spinal degeneration. If we know the cause of spinal degeneration, then we can put forth measures to actually prevent spinal degeneration. And in fact, we do know the cause, some of the causes. One of the reasons why sedentary lifestyles and obesity is related with spinal degeneration is because a lack of motion in the spine or a fixation of the spine can contribute to increased rates of degeneration. We know that. Another thing is there was a German anatomist by the name of Julius Wolff. He actually discovered, we call it Wolff's Law now, he discovered that pressure on bone causes remodeling, or basically, he discovered the cause of bone spurs. Bone spurs are a type of spinal degeneration. So knowing these factors, we can start to look at, well, what exercises, what strategies can we implement to prevent spinal degeneration? Even though we know that some forms of spinal degeneration, some forms of arthritis may not be completely preventable, could some of the things we do affect it and lower our risk factors for it? For example, we know that sometimes degeneration can be related to hereditary factors. Obviously, if you were born with some specific genes, we may not be able to fully prevent that. We know that injury to the joint causes that joint to degenerate at faster rates as well. So if you've been through some injuries, slips, falls, car accidents, repetitive stresses, we may not be able to fully prevent that joint from degenerating, but we also know that proper rehab, proper care can decrease your chances and decrease the rate of that joint degenerating. But because spinal hygiene is such a new concept, we actually have to create the definition for it. If you look in the dictionary right now, you're not going to see a definition of spinal hygiene. So our definition of spinal hygiene is this. Spinal hygiene is the set of practices that involves preservation of the spine, maintenance of the spine, but incorporates both home spinal care and regular chiropractic checkups. But what is home spinal care? And what should we do for home spinal care? The important thing is that we understand what a healthy spine is. Then we can determine what type of exercises would be most effective and be the most simplest exercises we could do to help us maintain the health of our spine. And we look at the spine, we look at three core concepts of spinal health. Number one, we know the spine should be in a certain alignment. If you look at any anatomy book that's published in any educational facility in the world, it will show a picture of the spine and it will show the normal alignment of that spine. The spine should be straight from the front and it should have natural curves from the side. We know this is a fact because we know that scoliosis is an abnormal finding. That's an abnormal alignment of the spine. And we briefly touched on this concept of Wolff's Law, that bone will actually remodel due to stress on it. So when we start to see misalignments of the spine, it causes abnormal movement of your spine, it causes abnormal stresses in your spine, and it can cause the process of spinal degeneration as well. So the concept of spinal alignment is very important. The second core concept of spinal hygiene is spinal range of motion. This is very important that your spine moves through a full range of motion. In fact, a study done by Tapio Vardaman, MD, showed that a joint that is immobilized or not moving for up to only 10 to 15 days can show signs of the beginning process of spinal degeneration. In fact, we call this term of movement in the spine imbibition. Imbibition is very important to move fluids into the disc and waste materials out. A lot of people don't know this, but around the age of puberty, we have a decreased blood flow to the discs of the spine. This is done because of hormone changes that happen, and you don't need as much blood flow there for growth of your spine. So with the decrease in blood flow, we also don't get those nutrients and the waste material moving like we need to. So this becomes very, very important that imbibition, the moving or the pumping of your disc, is there so that it helps keep your discs healthy. This is also why we see that the more sedentary your lifestyle, the less imbibition or movement that you get of those discs, and the higher chance you have of developing spinal degeneration. So making sure your spine moves is very important. And healthcare professionals across the board of all professions have been measuring spinal range of motion for many decades now. This is a very important part of your spine. The third concept of spinal hygiene is spinal strength and balance. So when we see imbalance in the spine due to muscle spasms, muscle tension, we know that can have long-term effects on your spinal health. That's why we want to make sure that those muscles are strong, they're fit, and they're also balanced. Those three core concepts, spinal alignment, spinal range of motion, and spinal strength, are how we came up with the home spinal care exercises that we recommend. So I want to go through quickly those 4 home spinal care exercises and how each one is going to benefit your spine. The first one that we talk about is an exercise called spinal molding. This helps us with the first concept of spinal hygiene, which is spinal alignment. We know that we need to go to our chiropractor to be able to maintain a proper spinal alignment, to be able to fix subluxations, fixations, and other health problems that can be related to our spine. But once we visit our chiropractor and our spine is in a better alignment, how do we maintain that alignment between visits? Well, one of the most important aspects of the spine is not just the spine from the front, that the spine should be straight, but the spine from the side, where we should have these natural curves. So we're going to use a process of spinal molding and spinal molding rolls to make sure that those curves are preserved between each visit. All we do is simply take the spinal molding roll, lay down on our back, place one roll through the middle of the neck, one roll in the middle of the low back, and exactly what this exercise is called is spinal molding. We let the spine mold around those rolls. The next exercise I want to talk to you about is what we call the ROM stretch, or the range of motion stretch. We know that the spine moves through 3 planes of motion: flexion and extension, or forward and back, what we call lateral flexion, or side to side, and the spine will also rotate in both directions. So all we have to do with the ROM stretch is take our spine to the end range of motion in each plane and hold it for 10 seconds. It's very easy, but it's also easy not to do. And imagine if you never take your spine through a full range of motion, a couple of years, and we start to see spinal degeneration. So this exercise is very important that you do on a daily basis. The next 2 exercises that we're going to do are focused on preventing some of the most common degenerative factors that are associated with the spine. Over thousands of x-rays that we've looked at, we've noticed that there are 2 segments of the spine that are most commonly degenerated. Most people will get spinal degeneration at C5, which is the cervical vertebrae, the 5th cervical vertebrae, and L5, the 5th lumbar vertebrae. Now, why would we get degeneration at these two levels? Why is it so common for us to have that? Number one, we look at the most common degenerative posture in the world, which is what we call head-forward posture. In a study by Kapanji that was published in the Physiology of Joints, Volume 3, he said that for every inch of head-forward posture that you have, you increase the weight of the head on the spine by an additional 10 pounds. That stress begins to break down the discs. The Mayo Clinic actually stated that anterior head syndrome, or head-forward posture, causes strained muscles, arthritis, disc herniations, and pinched nerves. So it's no wonder that this stressful posture needs to be corrected, and we need to address this on a daily basis. That's why we have our third home exercise, which we call our resistance band exercise. The fourth and final exercise that I want to go over with you today is the exercise disc. We use this exercise disc to keep imbibition, or movement, in the lower portion of your spine. It's simple. All you have to do is sit on the exercise disc and take your spine through its ranges of motion, forward and back, side to side, and rotation. That motion and that movement that you can get in the lower portion of your spine will help lower your risk factors for degeneration in that L5 disc. All four of those home exercises are vital that you start doing on a daily basis, just like you brush your teeth, so that you can maintain the health of your spine, just like you maintain the health of your smile. Your spine houses and protects one of the most important systems of your body, your nervous system. So the better you take care of your spine, the healthier you can be. And together, we can share this information. We can make spinal hygiene the household term it needs to be. Thanks, and we'll talk to you soon.